Hi, I'm Gavin Harris with the Region 4 SITREP. To Africa first, Nigeria. Lassa fever, as of the most recent available report 2 weeks ago, has claimed 176 people. This year, the country has confirmed 955 infections among 8,367 suspect cases, with an increased case fatality rate of 18.4% compared to 16.6% in 2024. It's believed that poor sanitation and late presentation of cases has contributed to this. We are currently entering the peak dry season in the country, and case counts are expected to rise. Global risk of spread is currently moderate. Next to the Democratic Republic of Congo, DRC, which declared an outbreak of Ebola virus disease on the 4th of September. On the 19th of October, the last Ebola patient receiving inpatient care was discharged, marking the beginning of a 42-day countdown. There are currently 10 days left. In sum, 64 cases have been reported, 53 confirmed, and 43 fatalities. Global risk of spread is currently low. And lastly, to Ethiopia, which on Friday, the 14th of November, declared the country's first outbreak of Marburg virus disease in the South Omo zone of the southern regional state. This is a zone bordered to the south by Kenya and Lake Turkana, and to the west by South Sudan. In Town, 17 suspect cases have been reported with 9 confirmed, several among healthcare workers, and 3 deaths. International teams, including those from the WHO, Africa CDC, and US CDC, are deploying to assist, and we do expect case counts to increase given the porous borders in the region. Global risk of spread is currently low. Next, in Southeast Asia, Cambodia confirmed the death of a 22-year-old man from H5N1. This is the 18th case in the country this year and one without a clear source of exposure. And like the most recent cases of the virus in the country, this has also been determined to be a reassortment virus between the older H5N1 clade and the newer one that is circulating globally. Global risk of spread is currently low. And in the U.S., the Washington State Department of Health has confirmed the first ever human case of H5N5, a highly pathogenic influenza strain subtype in a Grays Harbor County resident. The current patient, with underlying health conditions, is reported to be hospitalized and in serious condition with fever, confusion, and difficulty breathing. The source of the exposure is believed to be a mixed backyard poultry flock with exposure to wild birds, yet investigation is ongoing. No additional cases have yet been detected, and the domestic risk of spread is currently low. Finally, there have been no reports of suspect or confirmed patients with special pathogens of concern in Region 4 at this time. For more resources, visit us on the web at scdp.emory.edu.